Smith. My name is Brandon Bromley. I'm a student physical therapist at the University of St. Augustine. Can you tell me what brings you in today?
I'm having a hard time bending my fingers.
Okay. In reading your chart, I see you have limited finger flexion due to some OA. So we're going to do some heat modality. Okay? How does that sound? All right. Before we get started, I want to do an inspection of the skin. So I'm going to see if you have any open wounds, any discoloration. All looks normal. Can you flip over your hand for me? Good. Good. All looks good. Okay. We're going to use the heat modality to help stretch some of the soft tissue in that area and help loosen up the muscles. Okay?
Okay.
Before we get started, I want to do some sensation testing to help make sure that you can feel when the hot pack's on you, okay?
Okay.
So do me a favor, can you tell me what this feels like? You feel it? Okay. Close your eyes and look the opposite way and just let me know when you feel it, okay?
Okay. Yes.
Now,
No. Yes. Yes. Yes.
flip over your hand for me.
Yes. Yes.
Excellent. Okay. Before we get started, I want to do some goniometric measurements to assess how well the heat's going to work. So before we get started, if you can put your hand into a neutral position like such, we're going to use the goniometer. With my axis, I'm going to make it the MCP joint, and then my stabilization arm is going to be the metacarpal, and then we are going to measure it using the second phalange. So I'm going to ask that you bend your finger in as far as you can. So go like this motion for me. Like this. Excellent. All right, and now I want to see if I can have some tissue. Let me know if I reproduce any pain. Good, that's about end range. Okay. Good. I've recorded 46 degrees of finger flexion. So now we're going to begin with the heat pack. Ideally, I would like to use paraffin, but we don't have, so I'm going to use a hot pack. So I have my hot pack already wrapped. I'm going to put another a towel folded to give me 4 layers, and then another towel folded to give me a total of 6 layers. We are now, can you lift up your hand for me, please? Place in a comfortable position. Here, wrap it around this way. And then tight. Is that comfortable?
Mm-hmm.
Excellent. I'm going to set a timer using my mobile device for 5 minutes. I'm going to leave you with this call bell. If you have any questions or any irritation, feel free to ring the bell. I'm going to come back in 5 minutes. We're going to do a total treatment time in 15, but just make sure there's no irritation to the skin area, okay?
Okay.
Alrighty. 5 minutes has passed. And now let's take a look. Excellent. All looks good. Can you flip over your hand for me?
I would say.
Good. Looks normal. So we're going to continue and do another 10 minutes. So we're good here. Oh, okay. So we're going to do this treatment for another 10 minutes, and that's going to begin our therapy. We're going to do some other stuff after. Do you have any questions for me?
No.
So now that you're done with your heat modality, let's reassess and see how your finger flexion is. So previously you had 46 degrees, and now show me how much range you can go to by yourself. Excellent, and I'm going to push you just a little bit more. Whoa. This worked out very well. So it appears that you now have 54 degrees of finger flexion. That's excellent. And that concludes.